Hello, I'm Ed Rubenstein, Director of Environmental Compliance, Energy, and Sustainability at the University Health Network. UHN's Energy and Environment Department oversees all things sustainability at the hospital, from working with our partners in waste management, building operations, things like that, food, nutrition. Anywhere there's a sustainability opportunity, the Energy and Environment Department is involved. The Energy and Environment Department has two main ways we interact with others within the hospital. First, we may identify an opportunity and then find our partners or our collaborators within the organization to work towards implementing something, or they may have something in their own workplace which they identify as something they would like to do. They know we have the expertise, the tools, and the resources to help them implement those things. University Health Network developed the Office of Energy and Environment, I guess, because they saw a need for efficiency and things like that, so related to waste and energy, but also the link between environmental impacts of healthcare, environmental health, and creating health issues for the general population. So it really is a form of healthcare if you're looking at creating healthy environments. Management at the time saw all these things, they put it together, and they justified the case for at least starting an Energy and Environment office. We make efforts at UHN Energy and Environment Department to make sure that what we do aligns with the hospital strategy, the hospital's value and missions and things like that. And many times it's easy. Safety, right? So safety is paramount. Environmental safety is part of what we do. Efficiency, not wasting the limited resources we have. This is what we embed into the work we do. And also resiliency. At the end of the day, we are a hospital and our key focuses are patient care, research, and education. We need to make sure that whatever we're doing is going to make a healthier environment, but also supporting those key activities within the University Health Network. So one thing the Energy Environment is able to do when it comes to waste policies and practices is really do a bit of a deeper dive, find out what are the best practices out there, what is currently happening within an organization, and figuring out how we can marry the two together. There are going to be barriers, so we can identify those barriers. We have the opportunity, we have the resources, we have the time to try and overcome those barriers. And sometimes there's a bit of misinformation or something like that. So by really aligning all the people involved in the waste journey, from the people who purchase the things we eventually throw out, to those who use it, to those who move it around, to those who take it away, by aligning those, we find that we can get pretty strong policies that work towards best practice, but also realize the workflow realities and the operational realities within a very, very busy healthcare setting. In addition to developing these policies, we also develop the programs to help implement the policies or to breathe life in these policies. So to make sure that the people who need to follow what we've said we're going to do as an organization have the education, have the tools, have the resources, have the support they need to do that we really set ourselves up for success. And also let people know that they have an opportunity to feedback. If there's something in the policy that's not working or maybe conflicting with their workflow, they have someone who could listen to that concern, maybe address the policy or change the policy as needed, and come back and take things from there. So metrics are extremely important in any quality or environmental management program. So they can come from a number of places. They can come from third parties who collect things and maybe bill us in those things. But what we do is when we develop a policy and a program, we ask ourselves, how do we measure the success of this policy? And sometimes, if need be, we implement our own processes for collecting metrics, for collecting data. That could be mining existing data. That could also be maybe having someone go out and take a look around and auditing or something like that. So there's many different ways. We don't like to create work, so if there's already data out there we can grab metrics from, that's fantastic. If not, and we feel there's a real strong need for some sort of metric, we'll figure out a way of collecting that data or generating that data so it could go into our reporting and analysis. There can be many barriers to implementing policy. Part of it is just education. People don't know what to do. It's a very big, large organization, lots going on. It's by nature pretty hectic and complex. So just getting consistent messaging out there can be a bit of an issue. So the first thing the policy could do is be the source of truth, and then the Energy and Environment can make sure there's consistent messaging to all who need it. That can be through education, one-on-one. The other thing are, really assessing the impact of the policy by looking at some of the metrics we have, right? So is this policy worthwhile? Is it accomplishing what we hope it's accomplishing? Taking those metrics and then putting that into a bit of a feedback mechanism to let people know, do you know what? We've asked you to do something, you've done it, and these are the results. These are the benefits that we have, and here's the opportunity for growth. So it's really the ability to have someone to take ownership of the policy process, the ethos, and help the organization implement it. You'll identify those barriers and then come up with the ways of overcoming those barriers. Everything we do within a hospital impacts the environment in some way, be it performing a procedure, purchasing materials. So the Energy and Environment Department really works with everyone throughout the hospital. Some key departments, environmental services, facility operations, but also the clinicians, the men and women who actually provide the care and are taking care of patients. They have clear insight to their activities. So we have, I can honestly say we've worked with probably every department within the organization at some point. Either we've identified an opportunity and brought it to them, or they've said, we want to do things in a more sustainable way. Let's go talk to Energy and Environment and figure out how we can work on this together. I think there's a misconception that sustainability programs are a net cost to an organization, and maybe that leads to some hesitation. Absolutely, a sustainability program and people require an investment, but I think anyone who implements such programs will very quickly see there's a really good return on investment, both in terms of dollars and cents, but also other things, safety, other values, and other things that are important, especially in the publicly funded healthcare system, where we really want to lessen the requirement and the need for healthcare out in the community. Environmental sustainability is a healthcare activity. And especially in a publicly funded healthcare system in Ontario, where a large amount of our publicly funded dollars go towards healthcare, I think there's a very strong argument to have a sustainability program. And at the end of the day, it's going to make our hospitals and our healthcare system more efficient, but also lessen those things which are, potentially leading to people becoming sick and requiring more healthcare at our hospitals. So it is a cycle in a way. So the first thing to do is start collecting the data you have in the environmental impacts and opportunities. And then very soon you'll see that there is a dollars and cents business case. There are other non-financial benefits to having sustainability programs. And very soon you'll build the broader business case to implement this. And again, it's something that can and should support the organization's broader values, goals, and work objectives.